A rare moment of joy amid the fear of the epidemic. 45 patients at the Hastings Treatment Centre near the Sierra Leonean capital Freetown were confirmed Ebola-free Wednesday.
I can eat fine. My stomach hurts no more. My head aches no more, and also my neck. Nothing hurts, and I have no more pains.
The centre is staffed exclusively by Sierra Leonean doctors. That's rare in Sierra Leone's crippled health system, says Martin Drury, head of the British charity Health Poverty Action.
The important thing to remember is that whilst an Ebola outbreak is caused biologically, an Ebola epidemic is caused by a run-down, dysfunctional health system.
Drury says underinvestment is to blame, but so is what he described as the plundering by Western countries of health workers trained in Africa. A recent report from Health Poverty Action claims that Britain's National Health Service, or NHS, has recruited 10% of all Sierra Leone's trained medical workers.
Even before Ebola, you had just 320 hospital beds in the whole of Sierra Leone. The system was that weak before Ebola. Now it's incredibly weak, and yet, at the same time, people like me in the UK are being treated by doctors and health workers whose training was paid for by Sierra Leone, and that's just wrong.
In a statement, Britain's Department of Health said that healthcare professionals often want to spend time working in different healthcare systems to gain experience and skills. Martin Drury says there is a compromise.
We don't want to stop people migrating at all, but if health workers from the poorest countries are coming to subsidise the health system of the richest countries, we should pay some compensation back into their health system to make up for that.
The British government highlights its role in the fight against Ebola. London is deploying a total of 750 military personnel. The United States is deploying 4,000 American troops to fight Ebola in West Africa. Those boots on the ground are vital, says Sophie Harman of Queen Mary University of London.
If you just send money, you have a problem of what we call absorptive capacity. Where does that money go? And how quickly can it take effect on the ground with helping these countries and the people that desperately need the resources? So really what we need to see is more people being sent to these countries.
Liberia is one of the worst hit countries. Its president, Ellen Johnson Sirleaf, recently urged the hundreds of Liberian medics working overseas to return home. But her own son, a trained doctor, has opted to stay working in his adopted homeland of the United States, saying he can do more to fight the disease there. Henry Ridgwell for VOA News, London.